Walton.
Good afternoon, everybody, and thank you so much, Dr. Manning. A standing ovation, wow. I mean, Governor, that is all for you, and I want to start there too. I want to start with my gratitude for your leadership. You know, in a couple of years, we have gone from being a state that comes in bottom 5 for infant and maternal health consistently to now being a model that everyone's talking about what a small conservative state can do if they really put moms, babies, and families first. And when I talk to people about it, they say, what did it take? Like, what was the shift? And I say, honestly, I think it took a mom being in charge. So I thought to start, could you please perhaps just share, you know, as a warm-up, a time or two where you've had to actually juggle being both mom and the governor?
Well, first I want to say thank you so much to everybody who's here. Dr. Manning, thank you for helping get us kicked off and for your leadership in helping us turn the tide. You've been instrumental and been part of this effort from day one, and so we're so appreciative. And I'm going to take you, Olivia, with me to every event because I do a lot of them, and they do not all get standing ovations unless people are usually trying to sneak out before the speeches actually start. But you and I can get on stage together anytime because I think you're bringing the good luck. But in terms of balancing being a mom and being governor, there's not one story, it's every minute of every day. You know, we were talking in the hallway, Dr. Manning and I were, and comparing notes as kids are going back to school and you're prepping for practices and game schedule. I think my kids' logistics have started to become more difficult than mine. And so that is a huge challenge every night as we're going to bed. We're figuring out and making sure all 3 kids are accounted for and we know where they're supposed to be, when they're supposed to be there every day and planning that out. You know, as we're sitting here in this room and I know people are enjoying lunch, it kind of reminds me of a time my youngest George, who is 11 and in the 5th grade, last year I took him with me. We do a big take your kid to work day and really try to promote family and our kids seeing what their parents do all day. My kids think I have the most boring job in the world, and I try to show them that there are some exciting things and want them to experience and understand why I'm in this role in the first place, and the best way for them to see and understand it is to be part of it. And so try to take them with us as much as possible. And it was bring your kid to work day. And George was a little bit older than a lot of the kids coming, but he still agreed that he would come and participate. And our staff had put together a whole itinerary for the day. And part of it was they were going to play games and win prizes. And I was walking George through. He goes, what are we going to be doing all day? And I kind of told him, and he said, what kind of games? I was like, well, I'm not sure, George, but you know, you can win things. He goes, well, what kind of prizes? I said, George, I don't know, but I'm sure it'll be fun. He goes, Mom, as long as it's not one of those super lame, like win a lunch with the governor kind of things. So usually balancing being a mom and being a governor is that unique perspective that kids will give you, certainly keeping us humble. But I think one of the biggest things is my kids serve for me as a permanent reminder every day of what's at stake. I know that every single decision that I'm making as governor is going to impact my kids far more than it is me. And that's not something I take lightly. And frankly, it's one of the reasons I wanted this job, is because I was tired of seeing Arkansas continually at the bottom when I knew that we could be at the top. And so doing things that helped elevate life and opportunity in the state for my kids, as well as every other kid, is one of the biggest drivers, and certainly one of the things that gives me, I think, a great perspective in this role in helping lay out priorities and a vision for the state.
And how has your own journey of becoming a mother helped you understand just how important it is to support women and families through this period?
Sure. I think being a mom is hard. no matter what stage, whether you're in the pregnancy stage, whether you have toddlers, whether you have teenagers, and probably as you're sending them off to college. I'm certainly not prepared for that. I cried in the parking lot yesterday when my daughter was walking into the high school. So it was new frontier for us. I couldn't decide if I was, crying because she wouldn't let me get out of the car or acknowledge my presence in public, or because she was actually entering high school. So
I told you that my kids told me to dress better for drop-off, right?
Yeah,
I told you.
No PJs at drop-off. What if you
feedback.
have to get out of the car? Yeah, we were instructed not to roll down the windows. And so, playing it cool. But one of the things I think too, I am somebody who understands the process, had great medical care, had an amazing OBGYN, an incredible partner, great support system, and still pregnancy was really hard. My daughter, who is our oldest, and obviously the first pregnancy I had, I was in labor for 48 hours. It was miserable. I was not one of those people who was like so happy. I was just really struggled. I had a difficult postpartum experience with her, and that's with having a great community of support. That is with having great resources. So I know if it was that hard in that situation, how difficult it is if you're a single mom or somebody who doesn't have the access, the knowledge, the resources to the great care, and how challenging and difficult that is. And we never want somebody to feel alone in this process or not have the support they need from beginning stages all the way through. And so having experienced some of those own personal difficulties, it really motivated us to bring all the players to the table and figure out how do we make sure every mom in Arkansas has that support they need so that we really do ultimately have healthy moms and healthy babies.
You see, it took a mom being in charge. That's my point. And for me, it's a similar story. I have 3 kids. They're 8, 6, and 3. My middle daughter I had in May 2020. Not a great time to have a baby. And it was tricky. And, I had one child already, and so I could tell, she was having some feeding issues, and things weren't great, and I wasn't feeling great. But every time you call the doctor, they say, whatever you do, just don't come in. Call us if it gets worse, but don't come in. And I have, like you, the education, resources, a wonderful family, and it was so hard. And it was that realization that if this is so hard for me, I want to do everything I can to make it easier for other people. And so as governor, you understand this, but you actually did take your position and influence and turn the administration's focus to this. What made you decide to work on it through the governor's office? Was there a story, a conversation, or a statistic that really inspired you?
I think there were a couple of things, but one, Arkansas being ranked at the bottom. Arkansas being this is what you don't want to be. And as a mom, as somebody who has had that experience, that's not what we want for any woman in the state of Arkansas. And so knowing that we were last, one of the statistics that really was just kind of mind-blowing to me, as you know, and I think probably most of the people in the room, we have about 35,000 pregnancies in the state of Arkansas every year. About 10,000 of those women don't see a doctor until after their first trimester. And then about 1,100 women in the state of Arkansas did not see a doctor until they were in labor. To me, that is mind-blowing, to know that it was 9 months leading up to, they had never seen a medical professional, they had no support, no help, and that the first time that they were seeing a doctor was when they were actually in labor. That was probably one of the most eye-opening statistics. Again, it can be an overwhelming and scary process, and to think of somebody not getting the critical support that they need when going through it, that was probably one of the biggest motivators. And knowing that we have options and access available here in the state that already existed, people just weren't taking advantage of it. We have 92 county health units. I see Secretary Renee Mallory there in the back of the room, who helps oversee and administer all of our health units. We have a county health unit in all 75 counties, and in those health units, these women have access to pregnancy care and can be connected with doctors and resources they need. They just weren't taking advantage of it. And so knowing we had something that people weren't utilizing really, I think, was an eye-opening experience and something that kind of sparked something for a lot of our team to change the tide and do things differently than we ever had.
And the health units really are a remarkable resource, and the fact that they are underutilized is really just incredible. So I think that's a wonderful place to focus. So now that you've done all this, we're going around and saying, you won't believe what we're doing in Arkansas. You've got to do the same thing. So will you help everybody? Will you just kind of lay out what you actually did with Healthy Moms, Healthy Babies with your big package, and what in it have you seen a lot of promise from early on?
Well, I think, you know, one of the things that we did that I think has been game-changing in Arkansas, and it's certainly not something I did. Frankly, it's a lot of the people in this room are the stakeholders who were willing to show up and have hard conversations. First, we had to admit that we weren't doing things very well, and that's not always easy to say, hey, by the way, we're 49th and 50th, we know it, we don't want to stay there. What can we do? There are a lot of people that, frankly, had probably never sat at a table together. There were people I know that didn't vote for me, probably won't again, and that's okay. It was, how do we get people who care about this issue, who are involved in it, who are seeing it firsthand, that will have hard conversations. We expected when we first kind of rolled out this maternal health task force, which generally, I'll be honest, I really dislike task force.
I know you do, but this was a great one. Great one, thank you.
But this one is the exception, because a lot of times we create task force so we feel better about ourselves, so that we can say we've done something, and we can, you know, I brought a group together and I washed my hands and the process is over. I leave it to you guys now. And frankly, that's never going to work. If we want to see real differences, real change, we had to be willing to really engage and have those difficult conversations and bring people from every part of the process to the table. And when we announced that we were looking for strategic partners, honestly, we thought we might get, 20 people to show up. I mean, we had 150 people plus. They didn't just show up. They came in and spent real time, hours and hours talking through, looking at the landscape. Here are the big challenges we face. Here are current solutions that we have that we're not utilizing. Here are fixes that we need to implement. Here's what we think it will cost to do that. So not only did they really come to the table, they did real work, and then we went out and looked for the funding. There's a few legislators in the room. One of the things that I think you will learn in any type of undertaking like this, it takes a truly collaborative effort. Your team was instrumental in providing so much of the data and the research that frankly we didn't have the resources to do. And if we hadn't had that, it would have been really hard to build out that kind of long-term plan. So bringing those players to the table and then going to the legislature and saying, here's what we need. Here is the funding that we need. We were able to get about $17 million in federal funding to support our efforts. We now have $45 million that is in our budget to strictly focus on this problem, and we're making progress. We certainly have not arrived, and we have a long road to go, but the fact that everybody is sitting down at the table together is making a tremendous difference in the state of Arkansas. And that's all of the people in this room who have shown up today, but more importantly, have shown up over the last couple of years every time they've been called on to really be part of the solution and part of the process.
I totally agree. And Dr. Manning, you in particular, have been a very important piece of that glue. Are there other policies and programs? Because the bill was big. I mean, you had payment reform, you had investments in workforce, this fabulous postpartum call center. Are there pieces of it that you think we can point to nationally for other states to say, you need to go do this?
Probably one of my favorite parts of what we're doing outside of some of the policy changes is the awareness campaign. Again, acknowledging that we had some difficulties, but the Claim Your Care ad campaign that really, I think, makes and talks about some of the real challenges. We didn't want an ad campaign that was just easy and glosses over some of the difficult challenges. I think the team that put that together did a very good job of showing the realities of pregnancy, showing a lot of the different stages, again, from the early days to post-delivery, what some of those things look like. And so raising awareness and helping people have different access points to the support and the care and things that they need throughout every stage is something I'm really proud of, something I'm really excited about, and something that I think really changes the conversation, which is what we needed to happen here in the state of Arkansas. And I think it's something that can be used and leaned on in every corner of the country.
Yeah, because it's not just enough to actually pass policy. It's got to be implemented. People have to know about it. And so Claim Your Care is the state and the governor actually putting resources behind getting the word out. And that is huge. When you talk about that, you talk about this idea of no wrong door. Can you explain what that means?
Sure, and if I could just back up a little bit, because you touched on something that I think is really important. I say it a lot, and it will probably get me in trouble at some point, but passing legislation is frankly the easy part. I didn't say it was easy, I said it is the easy part, but the really hard part is execution and implementation. Policy ideas are wonderful and great, but if you don't have good people that are carrying them out, then it doesn't matter. And because we have an amazing team, I already pointed out Secretary Mallory, I know Secretary Janet Mann is here. I don't know if our Surgeon General, Dr. Kate Chandler, she may actually be delivering babies for all I know. But having this group come together, and no offense to all of the men in the room, you're wonderful and they play a key part, but I think having this female-dominated group of moms that were determined to change our state for every single mom and baby in Arkansas, I think really helped us turn the tide. They do an amazing job leading our agencies, leading their teams, implementing at the highest level, because without that, we would not have been successful. And so I want to certainly give a lot of the credit and the shout out to them because they've done the heavy lifting. In terms of the no wrong door policy, there are a lot of states who have switched to this model of one door, a one door policy trying to push everybody into one place. In Arkansas, we've taken a different approach, in large part led by what we call the 1033 initiative. But we know that people are going to show up to us in different places. Some may come to a county health unit. Some may go to their church in their community. Some may call our office. Some may go to a nonprofit that helps support pregnant women around the state. We know that they are going to come in many different places and many different forms and need a lot of different things when they get there. And so making sure that no matter what location they show up, what platform they come to us from, that we have the ability to provide the type of wraparound services. We have a unique technology platform that is integrating state government, nonprofits, the private sector, all into one place where no matter where you show up, we have the ability to say, we know that not only do you need medical care, you also need transportation, you need housing, you might need diapers, something that frankly, there are a lot of nonprofits that do a really good job doing these things already, but we didn't know about it and we weren't connected to it. And now we're bringing all those things into one technology platform so that we can really provide the type of comprehensive wraparound services that every person comes to us looking for. It's not just for moms and pregnant women, we know that there are a lot of people out there who have a lot of big needs, and being able to connect them to services that might already exist or be able to provide them through programming that we have is something we're really trying to change. And so that no wrong door, no matter where you come to us, we want to be connected and be able to provide care.
Yeah, and that's just huge for access. Another place you're also working to expand access is postpartum and this call center that we're talking about here today, because I just couldn't be more excited about that. You know, I like to say we need to rethink postpartum in America because the standard of care is come back in 6 weeks. I don't know about you. I needed to talk to somebody before 6 weeks. I need to say, like, is the baby too yellow? You take the baby. What happens is you take the baby in, but mom doesn't go back for her own checkup, and mom doesn't take her own stuff seriously. And so we're talking a lot about how we could really rethink postpartum support and make it more of like a year of family support, which is what people really need to get their legs underneath them with a newborn infant. You came up with, I don't know, was this your idea? Did you come up with it? Where did the idea of the postpartum call center come from? It just seems like such a powerful, no-brainer idea that everybody should be doing to expand access in the postpartum space. So maybe where'd the idea come from? What are you excited about the program?
I think it was really a collective of some of those conversations that came from the strategic task force. A lot of people say, what do we do after? I distinctly remember when I was pregnant with Scarlett, and you take all of these, classes about childbirth. I was in a hospital. I was like, isn't that what the doctors are for? Why do I need to know all of these things? It's when I left. I was like, you're just letting me leave here with this baby? Where's the instruction manual? What do I do now? And so, if you can put the car seat in right, it's like, great, you can take the baby home. I was thinking, aren't there more steps? Aren't there more checks? Don't you need to ask me more questions? Also, can I stay a few more days because I don't know if I'm ready for this? But it was once you left, like you said, those 6 weeks in between, you're learning all these new things, going through something in many cases you've never experienced before, and there is no instruction manual because it doesn't exist. So having somebody you can reach out to that can walk you through and say, no, it's actually completely normal that your baby's crying all night. But here's some things you might try so that everybody gets 30 minutes of sleep. Or this is something to watch for. If it continues, here are things you should look at. Or, just being a voice on the other side that helps, again, give that support, make sure that you're not alone in that process, and that you're getting guidance. If there are real difficulties, if there are real challenges, they can tell you, here's who you should go see, here's what you should do when you get there, here are questions that you need to be asking. I think that really came from just a lot of conversations across the board with so many people that were part of that task force that said from their own experience, I really could have used something like this. This would have been really helpful if I could have had that when I was going through that. And then it was the team that I identified earlier that really took it to the next level, figured out how it would be set up, how it could be staffed, all of the pieces that really make it work. They went out and just rolled their sleeves up and got it done.
Amazing. And these checks, they don't have to be done by an OB. Right? It's about having access to a ladder of care. I don't know, if it's a nurse or it's a midwife or some kind of other care provider that's a professional that's able to identify signals and then send you up the ladder of care, but at least you're getting some kind of check in those early few weeks. And it is so incredibly preventative. I mean, it is clear these kind of postpartum checks bring down hospital readmission rates, result in preventative savings. So we couldn't be more excited about the postpartum call center. You mentioned the awesome team of moms around you. To end, it is mostly women here. There are a handful of men. We're glad to have you. Sometimes we struggle with how to frame maternal health. And so I'm curious if you have any advice about how to talk about it in all sorts of settings. We say, it's not just a women's issue. it's a family issue. Sometimes we say, no, we need to frame it as an economic issue and a workforce issue because they're not going to care otherwise. What advice do you have about how to talk about maternal health so that everybody really understands what's at stake?
I think you made a good point just when you were kind of opening up in that question. I think one of the mistakes we make is trying to say that everybody's experience is the same, and trying to put everybody into a box. It's going to look different for everybody. And so in being willing to have those conversations, to your point, for some people, it's not a doctor, it's a doula, it's a midwife, it's a community health worker that helps provide what that individual needs and what it looks like. I mean, just with my own 3 pregnancies, they were all totally different, and I needed very different things. And so imagine the 35,000 pregnancies that we have in the state every year. Those are going to look different. So not assuming that everybody's process is the same and that everybody's need for care is going to look exactly like somebody else's. That would be the messaging. For some people it is. There's an economic question. For some people it's an access question. For some people it is an education piece. And so knowing that there are a lot of different parts of the process, it's going to look different for everybody, I think is one of the things that we have to be realistic about. It's not one message. It's that we want to provide what needs somebody or be able to provide support to meet whatever needs somebody has that's going through that. We've kind of been a little bit hard on the men in the room, but having a really good partner makes such a huge difference. My husband changed more diapers in the first several years of our kids being born than I did, because that was what he could do. That was part of something that he could do that was an everyday task that was really helpful, really supportive. And so that's what we need for every woman to have, is giving them value add, whether that's through their spouse knowing how to change a diaper, whether that's through their doula or midwife, having access and payment structure that makes sense. Those are the types of things I think we have to really look at, is how do we elevate the conversation so that every single person's experience that's going to be different has their needs met wherever they are.
Thank you. So at Healthy Moms, Healthy Babies America, we're really trying to pull a couple different levers. And so we talk about collaboration. You talked about how important the stakeholder group was to really bring people from different areas together. What opportunities do you think, as the governor, you have to really collaborate across sector? Because that's where the magic happens, right? When you can get the employers working with the nonprofits, working with the policymakers.
I mean, I think that what you have done in creating national awareness is bringing so many more players to the table. It goes back to where this started. It was a collaborative effort. If we hadn't had the buy-in from the private sector, if we hadn't had buy-in from state government, if we hadn't had buy-in from the nonprofit community, from the medical community, we would not be making any progress. When you silo things off, they stall out. And we see that over and over and over again, particularly in government. We like to kind of operate on our own and not bring other people in. And that's a huge mistake, because so many times we're not going to be the point of care. We're not going to be where people come to, but that nonprofit location in a small town, or the doctor that's in that community but needs to be able to connect them to state government services. All those things kind of being integrated makes such a huge difference. I think the Healthy Moms, Healthy Babies campaign is raising awareness, and more people are saying, wait, we do things like that. This is the space we work in. We want to participate, knowing that it exists and raising that awareness that you and your team have done so effectively, and not just here in Arkansas, but nationwide, and making it a normal part of conversation. I think sometimes when things are hard, we just want to pretend they don't exist. And so facing this challenge head on, not being afraid because we know it's going to be really difficult to see the numbers change for the better. And your team has not been afraid of that. You've had those big conversations, raised awareness, and it's bringing a lot of new partners and people to the table that ordinarily I don't think would be working together.
Thank you. I really, really appreciate that. There's this expression, I could live off the fumes of a good compliment. I don't know if anybody has heard that, but that's how I feel about that. Thank you. We're working very hard on it, and my team is here. I'm having that mid-40s kind of blackout, what I was going to ask you next. We're 1 year into this. What are your hopes and dreams for success 5 years from now?
You know, for me, it's really simple. The mortality rate in Arkansas is not where we want it to be. If we can improve that by even 1, that's progress. But I would like to see where that is not a problem anywhere, and where these certainly preventable problems are being addressed, people are being helped in earlier stages. You know, we don't want to set the bar low. So that we can meet this low bar for ourselves. We want to set the bar really high and meet expectations because we did hard work. And so shifting Arkansas, instead of us being 48th and 49th and 50th in infant mortality, we want to lead the nation. We want to be number 1. And the reason we want to be number 1 is not so we can say, oh, look how great Arkansas is. It's because that means we legitimately have healthier women in our state, and we have healthier babies that are living their best life, and they're doing that in Arkansas. That's the ultimate goal. This is about helping every single person at every single stage live their very best life. And we want them to do it here because we're very biased. And I think this is the best state in the country. And I want every opportunity and there to be no limit to what we can do, to what we can accomplish. And I want Arkansas to lead the nation because it means we're truly changing and saving lives. And that's the goal.
Well, I think we're on our way. Thanks to you. I remember what I was going to say. The compliment got me flustered. I was going to say, nobody is against this. It was actually somebody at HHS who said, well, what's so hard? Nobody's against this. I was like, you're right. Everybody is for this, and the solutions exist. We did some polling. The things the governor is doing, like telehealth, expanding paid leave for teachers, there is over 80% support from Rs, Ds, and independents in this kind of thing. So I was going to say that's what gets me really excited. If I were to make an ask of people in this room, I actually have 2, if you'll put up with it. The first is, have you heard of the Perinatal Improvement Collaborative? This is a priority from HHS, from Dr. Dorothy Fink at the Department of Health and Human Services in Washington. It is a program that is in 200 hospitals across the country right now. The hospitals that have implemented it have seen their maternal mortality rates drop by over 40% in 1 year. It's basically a dashboard giving you, as care providers, more real-time information what's happening with your patients. If you're interested in participating, we hope you are. We'd love to, we're happy to help philanthropically to fund some of the change too, but you can get with any of the ladies here at this table. And then my second ask really of the audience would be kind of what we were talking about with the postpartum. This call center is incredible. There are other things that works too. There are home visits. The big picture change we have to make though is to really stop thinking that discharge from the hospital is where the journey ends, and instead really start to think about it as the middle of the journey, because 2/3 of maternal mortality happens after mom and baby come home, happen in those 12 months. And again, it's overwhelmingly preventative, but we need to kind of change the way we really think about postpartum care. And so I will close just by thanking you again, Governor. We are so lucky to have you leading our state, to have a mom leading our state, and thank you for making Arkansas an example of what investing in families can really look like and what a state can do when you have the will, the focus, and the expertise to invest in moms and babies. Thank you.
Thank you, and thank you for... Thanks. And thank you to everybody who is here today. Certainly you wouldn't be here if this wasn't an issue that you cared about, you weren't passionate about. And so grateful for those of you who are willing to show up and continue to help us solve this problem. And I also want to say thank you to you. You honestly could do whatever you wanted, but you choose to take this on. You have been willing to not just show up at an event and make a speech and leave, but really have a depth of knowledge and level of commitment to seeing this through that very few people would have, and putting the level of commitment and resources that are needed to really make a big difference. I say all the time to you how grateful we are that you're willing to help support this effort, not just in Arkansas, but to raise awareness nationwide. And so thank you for your leadership and commitment to seeing us elevate Arkansas, to elevate moms, and to support babies. And so we're incredibly grateful for your willingness to take it on. So thank y'all for being here today.